Okay. All right. Hello, everyone. Hello, Final Frontier Warriors. I'm Ravneet Singh. I am your lead instructor, but not here. I'm your host right here in the podcast season hosted by the PCE Final Frontier team. And I'm going to be your host, and I have a very special guest with me, Vrunda Kapadia. Welcome, Vrunda, to the podcast. And this is our second episode and your first official guest. And lead instructor, but not here. Wait a second. I know something always has to go. Okay, there you go. Perfect. I'm completely mute on my YouTube so that you don't hear my voices back and forth. So let's welcome Vrunda. She's our very first, I don't want to call her non-PC Final Frontier guest because she has invested a lot of time in PC Final Frontier because she's not one of the lead instructors. So I want to call her a guest because I want to give her that importance in this episode, okay? So Vrunda, thank you very much for joining in. How are you doing today?
I am doing very, very well, Ravneet. Thank you for having me. And hello, everybody. Hello to everybody who's joining. Ravneet, I met you about 4 years ago, and it's been so amazing to see you grow. And I've seen PC Final Frontier since its very beginning, its childhood days. So I think it's phenomenal what PC Final Frontier has achieved. So kudos to you and your team.
Perfect. I want to start a new Vrunda's introduction, but let me just hit record so that we don't lose anything from this podcast. All right, perfect. We are officially recording and we are officially taking your questions in the chat. So let me just introduce Vrunda officially. I had to make this list like what Vrunda is doing nowadays. Okay, so listen to this. Vrunda is MS, she's DPT, she is board certified orthopedic specialist, OCS. She just got her vestibular certification recently, right? She's chief operating officer in one of the nonprofit organizations in the United States. She's a member of the American Physical Therapy Association in United States. She's been neuro expert in NPT Final Frontier for, I don't know, more than 4 years. Right? Yeah. She is lead instructor and she's the founder of the APC, which is physical therapy examination in Australia. And she is leading the whole project single-handedly and helping the Australian PTs to pass their boards. I'm sure this is not a complete list. I'm sure that I'm missing something, Vrunda. I will let you fill the gaps, but I just want to say something, man. I've worked with a lot of people, and I have huge respect for everyone that I've worked with. But at this age, meeting all these new designations is commendable. I mean, it's not just because you're my friend and we've been working together. I mean, it's inspirational. It's legendary. Like, how many people do you know at this age? Well, let me just clarify. I don't know her age, and I don't want to disclose her age because she's still single. So we'll keep that a secret, but she's not 30. I can tell you, she's not 30, yeah, but she's not even close to 30. Let me just clarify that more. But doing all this at this age requires a different level of ambition. And I respect that a lot because I myself consider as the ambitious person. So I respect that a lot. Like, how much can you do in a day? When a lot of people are complaining they don't have time, people like Vrunda proves that you can make time for your priorities for what you want to do in your life. So Vrunda, I said a lot of things: MS, DPT, OCS, vestibular, COO, lead instructor, founder. Tell me something else that I missed from this list.
I think more than talking about myself, I think you kind of mentioned a lot of things. But yes, I agree with you, right? It does take time and it does take a lot of effort. And the one thing that I tell the people that I meet is just that as far as you love what you do, I don't think it feels like work, right? I know on paper it sounds like, oh my God, you're doing so much, right? But I think at the end of the day, it doesn't feel like work because I enjoy every single thing that I do. And I'm as ambitious as you are. I think I've been blessed to be surrounded by visionaries and people who themselves have done such a good job and who've set such an amazing example, right? And they are the ones who inspire me. So I think that's another thing that keeps me going. So I hope somebody else finds inspiration in this and they continue and they pursue their dreams and just continue working hard. So I think that's, if even if one person does that, based on my story, I think I will have succeeded in life.
Absolutely. I think before we start our domination on neuro, I just want to send this message out. Final Frontier is not just about teaching. Final Frontier is about advocating PTs, advocating for PTs, right? So if you want to talk to Vrunda about the career aspect, you don't want to talk about physiotherapy, Final Frontier, you don't want to talk about Australian physical therapy exam, PCE or NPTE or, anything. If you just want to talk about like the life, if you just want to talk about like how to organize the stuff and how to meet your goals every day. And I think she's a great mentor in teaching people, like keeping a vision is okay, but how to implement, how to become an executor and how to become a doer is really something that I also learned from Vrunda. So if you're somebody who can take the advantage of becoming a good organizer, a good leader, I think Vrunda would be a great source to talk with.
Thank you for saying that. And I'm always happy to.
Great. Okay, so we do have one of your biggest fans in the chat. That's Dr. David Friedberg, who is here to encourage you. So thank you, David, for joining in the chat. And you also been a great encouragement to a lot of PTs in the world. So let's start it, Vrunda. Our topic today is how to dominate neuro. For a lot of people, neuro is a topic which has overlapping symptoms. And for a lot of people, a neuro is a topic where, if it's spasticity, the treatment of spasticity. If it's flaccidity, the treatment of the flaccidity. But what makes a neuro tricky is remembering a lot of stuff for example, take an example of any big chapter like Parkinson's disease, stroke, or any other big chapter, 100 pages, right? You gotta know everything about that because you don't know what they're going to ask in the exam. So how do you become confident in neuro? This is what we're trying to learn. Like for someone who just started today, or for someone who has an exam in about 3 months, what suggestion do you have and how do they make a plan? So over to you. You can talk whatever is in your mind, or if you're prepared anything, you can share that information with us, but just try to inform everyone like this is not impossible, and if you have retention issues, this is something that you can do to remember that stuff. This is what our goal today is.
True, and happy to do that. Let me go ahead and share my screen with all of you. So like Ravneet mentioned, right, our topic for today is dominating neuro section, specifically for your PCE exam, right? And the goal of today's discussion is not to go into like depths of each and every single topic that you're supposed to study. Our focus for today is essentially going to be like an overarching view, like a bird's eye view of like all the concepts, and just trying to understand what are some of the tips that you can use as you start prepping for your exam, right? So the one thing that I always tell all of the students that I work with is that your basics have to be strong, whether it is the functions of your lobes, right? Whether it is your tracks, whether it's the words, right? Terminologies that they use, right? You have to know what it means, because if you know your basics really well, right? Even if they ask you a very, very tricky question on the exam, you are going to be able to answer it, okay? And I'll give you an example for that, right? For example, let's say, let me go ahead and type on the screen, okay? VBI syndromes, right? That's something that a lot of students always talk about, right? They say, how do I remember VBI syndromes? How do I know what is affected, what is not affected, right? So say, for example, if I were to ask you, is pain and temperature affected with your, is pain and temperature affected with is pain and temperature affected with lateral pontine syndrome infarct, right? Pontine syndrome infarct, right? Is it affected or not, right? And maybe you don't know the answer, right? But if you know that pain and temperature is essentially carried by your lateral spinothalamic tract, right? Pain and temperature is carried by your lateral spinothalamic tract. So just based on that, like if I say lateral spinothalamic tract, right, you know that this tract is located laterally, right? The name itself is telling you this tract is located laterally. So if you know that pain and temperature is carried by the lateral spinothalamic tract, which is located laterally, there's a very high chance that your lateral pontine syndrome will have involvement of pain and temperature, right? So little things like these, if you understand these little concepts, if you understand your basics well, if you know the functions, if you know your tracks, it's going to be very important. It's going to be very easy for you to remember these VBI type big questions, right? Another example that I can give you is your spinal cord syndromes, right? With your spinal cord syndromes, a very common question that students ask me is, how do I remember all the spinal cord syndromes, like all the functions that are affected or the functions that are not affected, right? So if I were to ask you, is proprioception, right? Is proprioception affected with your posterior cord syndrome? Is it or is it not, right? You guys can answer in chat if you're watching. Is proprioception affected in in patients with posterior cord syndrome or not? And maybe you don't know the answer, but if you know that it's your DCML, which is your dorsal column medial lemniscus, right? It's your dorsal column medial lemniscus. So it's your dorsal column medial lemniscus that essentially carries the sensation for proprioception, right? If you know that, and if you know that dorsal essentially means posterior, there's a very high chance that you're going to be able to say yes, proprioception is affected in patients with posterior cord syndrome, right? Or if I say somebody has an anterior cord syndrome, right? If, say, for example, your patient has an anterior cord syndrome, right? What is going to be affected? Your anterior spinothalamic tract, which essentially carries crude touch, right? You know for a fact that that is going to be affected. And you also know that your proprioception is not going to be affected, right? Your proprioception is not affected with anterior cord syndrome because your proprioception is carried by DCML, which is dorsal column medial lemniscus, and dorsal means posterior, right? So proprioception is not affected with an anterior cord syndrome. So if you know your basics, your functions, your tracks well, it's going to be very easy for you to understand those larger concepts. So as you embark on this journey of prepping for your PCE, and when you start studying for all of those neuro topics, go back to your basic neuroanatomy. You might think that, okay, they do not really directly ask about tracks, and they may or may not do that, but no, study your basics, because so that you can understand those more complex topics. Okay, so that's going to be strategy number one. Okay, the second thing is going to be always ask why. Okay, if you're studying a concept, right, don't just sit and by heart, okay, this is seen with so-and-so diagnoses, or this is seen with this diagnosis, right? Always ask the question, why are you seeing that specific sign or symptom with a specific condition, right? For example, when we talk about multiple sclerosis, right, a very common question that students ask me is multiple sclerosis and GBS. They always say, I'm always confused between these two. Like, how do I remember it? How do I know which one has spasticity, which one doesn't have spasticity, which one has decrease in reflexes, so on and so forth, right? So MS versus GBS is one of the best examples I can use for this specific concept, right? Now, your multiple sclerosis is essentially a demyelinating condition, right? And what does demyelinating mean, right? Demyelinating means we all have these neurons in our body, right? And going back to your basics and your physiology, does everybody remember what saltatory conduction is? And let's see what you write in. Chat. I'm going to keep an eye on the chat. Do we remember what saltatory conduction is? So essentially, what happens is we have these neurons in our body, right? And they basically help to conduct an impulse, right? And we have these myelin sheath over here that basically help us conduct the impulses faster, right? So the way your impulses are conducted is like zoop, zoop, like that saltatory conduction, right? It's a quick conduction that we have. And this is what is seen normally, right? But for somebody who has a demyelinating condition, what happens is this myelin sheath is actually destroyed. It is an autoimmune condition, okay? It is an autoimmune condition. So your body tries to essentially destroy itself. right? Your body tries to destroy itself. So all these myelin, the myelin sheath over here is destroyed. And because of that, that is what essentially causes multiple sclerosis. That is what is called demyelination. Okay, that is what we call demyelination. So this is what happens in patients with multiple sclerosis. Now, remember, demyelination happens in patients with multiple sclerosis, and it also happens in patients with GBS, right? Demyelination happens in patients with multiple sclerosis, and it happens in patients with GBS. But multiple sclerosis is classified as an upper motor neuron disorder, and GBS is classified as lower motor neuron disorder, right? So ask the question, why? Why is multiple sclerosis upper motor and GBS lower motor neuron disorder, though they are both demyelinating conditions, right? And the answer goes back again to your neuroanatomy, right? So if you look at this, right, this is essentially, and this again goes back to your basics, right? If you look at this image over here, in orange, you have this brain over here, right? And then you have your spinal cord. Your brain and your spinal cord form a part of your central nervous system, right? Your brain and your spinal cord form a part of your central nervous system. Versus when you look at these structures in yellow, right? When you look at these structures in yellow coming out of the spinal cord, right? Your nerve roots, your spinal nerves, your peripheral nerves, right? They essentially form a part of your peripheral nervous system because they're going more peripherally, right? So whenever your peripheral nervous system is affected, it's going to cause lower motor neuron type of a presentation, versus when your central nervous system is affected, it is going to cause more of an upper motor neuron type of a presentation, right? And that is why whenever somebody has GBS, so GBS essentially affects the peripheral nervous system structures. So the demyelination happens in your peripheral nerves, right? Versus with MS, that same demyelination happens in the brain and the spinal cord, which are your central structures, right? And that is the reason, though both these conditions are demyelinating conditions, demyelination in multiple sclerosis happens in the central nervous system, and that is why you see upper motor neuron type of a presentation, versus demyelination in patients with GBS happens more in your peripheral nervous system. And that's the reason, knowing your etiology, your pathophysiology, just asking the question, why am I seeing this kind of a presentation when both of them are essentially demyelinating conditions, right? So asking that question, why, can be really, really helpful with, one, understanding the concept, and two, once you understand the concept, it's very easy to retain that concept, right? And then again, talking about your basics, right? The one thing that I really like about the PCE Final Frontier timetable, right? All of you have access to your pre-course material, right? If you go over your pre-course material, or even if you're just sticking to your timetable and doing those daily readings, your timetable has been designed in such a way that we first start with your basics, right? You first learn what the circle of Willis is and what are your cranial nerves, right? You just start with the basic stuff. And then if you look at your timetable, we kind of advance a little bit more towards your advanced topics like multiple sclerosis, so on and so forth, right? So early on, you learn more about what is upper motor, what is lower motor neuron lesion. And then you talk about different diagnoses where you can have an upper motor or a lower motor neuron type of a presentation. So just something to think about and something to remember, that make sure you start with your basics and understand the concept. Always ask the question, why? Okay. Next is going to be visualize. And I cannot emphasize how important this is and how useful this is, especially if you're a visual learner like me. I think using images and diagrams and charts is something that's going to be really, really helpful, right? For example, when you're studying musculoskeletal system, right? If say you're studying about the shoulder joint and you're talking about mobilization or just movement, right? So when I'm doing this movement, I can look at my arm that, oh, like my humerus is going up, and then that means at the glenohumeral joint, if I do an inferior glide, right, that's going to help improve my abduction. It's so easy for me to, even if I'm teaching you this concept, or even if you're studying this by yourself, right, you can easily do this by yourself and remember the concept or understand the concept, right? Or if you're looking at your elbow joint, or if you're focusing on gait, right, you know that you're going to get that heel strike first. When I say heel strike, you can see that there's dorsiflexion happening, right? So it's very easy, a little bit easier to visualize your orthopedic concepts, right? But versus the brain, it's a little tricky, right? You can't really see your brain. right? And for those reasons, just using images, Google is such an amazing, amazing, amazing tool. Like if there's any new condition that you see or any part of the brain that you're studying about, just Google it, just see where it is, look at an image. That's something that's going to be very, very helpful, right? And even when you talk about, say, conditions, right? I think one of the biggest aha moment for me when I was getting started with my neuro prep was conduction versus sensory neural hearing loss, right? Conduction versus sensory neural hearing loss in patients, in our patients, right? When you study about conduction versus sensory neural hearing loss, when you're studying about the function of your cranial nerve 8, right? And I know everybody focuses on learning your Weber's test and your Renee's test, right? But don't just directly jump to the test and understand, like, just don't focus on the interpretation of the test, right? The answer is, the goal is not just to by heart everything and move on, right? You want to understand this because at the end of the day, you're going to be applying this on your patients, right? So, and that is going to guide the interventions as well, right? So what essentially is your conduction hearing loss? Like, why does the Weber's test cause lateralization to one side versus the other, right? And for those reasons, again, images can be really, really helpful, right? So when I had just said conduction versus sensory neural hearing loss, you're like, okay, fine. What, like, I'll remember that, right? But what exactly do I mean by that, right? So, oops. Okay, so what I mean by that is, and let me move this to the side. Okay, conduction hearing loss. As you can see in this image over here, you have your ear over here, right? And then you have your ear canal, and then you have your middle ear, and then you have your inner ear over here, right? So when I say conduction hearing loss, right? Conduction hearing loss, as you can see, kind of mainly involves the external part of it, right? Your external ear, your middle ear per se, right? Versus when I'm talking about sensory neural hearing loss, you can see now this is affecting the deeper structures, right? It's affecting your inner ear per se. Versus conduction hearing loss is just an external thing, right? So say if you go to the library to study, right? And maybe it's really, really noisy, and you take out your headphones or you take out your earplugs and you put those earplugs inside your ear, and then now you can barely hear anything, right? It blocks all of that sound in the around you, right? So that is you creating a conduction hearing loss, right? Because you put the earbuds over here, right? So that is essentially just blocking that outer ear, right? And that creates a temporary and intentional conduction hearing loss, right? Versus people who are aging or people who are old, right? People who they essentially have a sensory neural hearing loss, right? Genetics is another reason for sensory neural hearing loss. Sometimes patients can have tumors in this inner ear region, and that can cause that can cause sensory neural hearing loss, right? So just even if you look at this picture, it will really help you understand what do I mean by conduction loss and what do I mean by sensory neural hearing loss, right? And that's going to guide the intervention, because if it's conduction hearing loss, basically sometimes you can just take out the obstruction, right? Or if it is like an external ear infection or something, they just give you antibiotics to treat that, right? Versus for the sensory neural hearing loss, if there's a tumor or something which is deep inside, they go ahead and operate it externally, like they go ahead and operate on it, right? They do a surgery. Or if it's age related, sometimes you can't really do anything about your sensory neural hearing loss, right? So just remembering these little things will help you understand and retain the concept better. So make sure you always pull up images and visualize these concepts, okay? So Ravneet, I'm gonna pause for a moment and see if you have anything to add to this.
Are you kidding me? Do you think I should add anything in this, like, powerful like session? Like, I seriously, I am stunned right now. Like, and I want to tell this to everyone. Like, do you think, how many of you think Vrunda is reading something and talking to you? How do you think Vrunda is just going in a flow? Vrunda is just talking about the concepts. I'm surprised for a moment, like, how much can a person know about a topic? What is that thing that motivates somebody to learn the concept in depth? You see, there are always two kinds of people, right? I believe that there are two kinds of therapists, and no judgment to either of them. I just want to say, like, there's a therapist who wants to go to the work, who wants to make a lot of money. Great, that's amazing. And there's another therapist who wants to go to work and make a difference. And of course, that therapist is going to make a lot of money as well. Who do you want to be? A lot of people may be thinking like, I don't think that's required for PCE. I don't think that's required for my licensing. What is your goal in your life? And that's where you have to focus. Do you just want to be a licensed therapist, or you want to be someone who know what they're talking when you're talking to the patients? Imagine after about 5 years of your practice in Canada, and you have a student, and if student comes to you, you have an intern, you have somebody who wants to do their clinical hours, somebody who comes to you and asks you the question about GBS and MS. There are similarities, but what makes them different? Do you have the answer? Are you the clinician who have the answers to the questions, to the patients, to the physicians, to the students, to the caregivers, or to the fellow PTs? This is what we're talking about. And this really gives me goosebumps. Like a person like Vrunda, imagine like how much do you think you're going to study anything after the license exam? Vrunda, have you studied these concepts before the license exam or after the license exam?
I think learning is a work in progress, right? You constantly keep learning.
That's a great answer.
Growing.
I knew what's coming, but what I'm trying to say is like, if you think you are going to study something after you cleared the exam, that's most likely not going to happen. We don't really have time to go back to the books while we're treating our patients. Yes, there are some instances where we want to learn. And I know Vrunda, when she started working in the Duke Medical Center, she used to tell me like, Ravneet, I've studied this, but I had to come back and look into different resources about this particular pathology that we have studied, but this case is completely different. I know the pathology, but I have to see what I can do for the patient. Vrunda, do you remember what that was? I can't remember the syndrome.
I think there have been a lot of instances now, but yes, I remember early on it was
Something
more
with
frequent.
neuralgia. Something with neuralgia. I remember that one day you called me and you said like, I've seen this concept, I've studied this concept, but I don't know how to implement it. Like Vrunda said, it's a learning process, but how many times will you take that effort to go back to the books while you're treating the patients? How about we become that person right now to start learning, to build that curiosity in your brain and start getting mature with the concepts. This is what we're talking about. We're not talking about pass your PCE, start practicing, start making $80,000. We're talking about pass your PCE, start making $80,000, but become a competitive physiotherapist who can really make a difference in your setting. So yeah, Vrunda, go ahead.
That was powerful. Thanks for sharing that. But yes, absolutely. I think having an open mindset is very, very important. Like, don't hesitate. Like, all of this is going to help you gain that confidence, right? It's going to help you gain that confidence to step in the clinic. So make sure you don't skip these things. A lot of times students will ask, okay, what can I skip? And yes, I understand time constraints and there's so much to remember and retain, but you want to make sure you prep as much as you can, prep for as much as you can.
Yeah. But I want to add one more thing. One of the biggest enemy for anyone is procrastination, right?
Very true.
I'm studying something, and I think everyone can relate that. I'm studying something and I'm going through some terms. For example, asthenia. I'm just taking, that comes into my mind, asthenia. So these are the symptoms of this disorder. And one of them is asthenia. Okay, I made my point. Okay, move on. Do you know what asthenia is? If not, then Google it right away. Watch a video right away. We need to give importance to these terms at that moment. Don't keep it for Sunday. Don't keep it for Saturday. Quality studies is very important, because while you're studying, and if you know what asthenia is, the concept, the topic will make more sense to you. So just one example, right? Instead of making a list for next day, try to finish that topic with a good quality studies. And of course, you want to have a list for your weekend, but you always can reach out to one of us to, okay, this is my easiest thing to do. Let me text Ravneet, and this is what I can do, but I have to focus on the other things. But what if that thing does not make sense to you if you don't know the term? So Vrunda will talk about the procrastination, because initially I said that, you're one of the person who knows really how to implement the stuff. So we'll keep that topic 5 minutes conversation in the last, but okay, I won't disturb you at all. So go ahead, whatever you have next in your slides.
Sure. So the next one I think is everybody's favorite, which is mnemonics, right? Of course, we discussed not just moving on, making sure you understand the concept, you understand the basic, you ask the question why before you move to the next concept. So maybe you're studying everything and you're doing everything right, but then retention, right? Retention can sometimes be a little tricky. And for those reasons, using mnemonics can be really, really helpful. For example, this, right? This is such a cool image. I love how colorful it is. I love how it tells you about the location of all the different nerves, right? And for any visual learner, I think this feels like it's great, right? I can see that the cranial nerve 1 is located over here in the cerebrum, and I can see the cranial nerve 2 is in the cerebrum, and then the 5th cranial nerve is here in the pons, right? So visually it looks great, right? But then how do you retain this information, right? And that's where mnemonics can be really helpful, right? For this specific one, which is the location of your cranial nerves, the CME pons medu is one of my favorite mnemonics, right? So CE essentially stands for cerebrum, right? And you need to know what the cerebrum is before you move to the next one. So you have your cerebrum, then you have your me, which is the midbrain, right? Then you have your pons, which is your pons, and then you have your medu, which stands for your medulla, right? So you have your CME pons medu mnemonic that can help you remember this information. So CE is essentially 2 alphabets. Okay, CE is 2 alphabets. So your first 2 cranial nerves are going to be located in the cerebrum. Then that's C. Then you have me, which is your midbrain, which is the next 2 alphabets, that's where your 3rd and your 4th cranial nerves are. Then you have pons, which is the next structure, and that is where your next 4 cranial nerves are going to be located, because pons has 4 alphabets. And then you have medu, which is your medulla. So you have the last 4 cranial nerves located in the medulla, right? So if you remember your CME pons medu, and you remember this image, it's going to be very easy for you to remember your cranial nerve. So as you can see now, your cranial nerve 1 and your cranial nerve 2 are essentially in the cerebrum. Cerebrum is this structure over here, right? Your cranial nerve 3 and 4, so in yellow and in pink, you can see your 3 and 4 are in the midbrain, right? Then this circular structure over here is your pons. So as you can see, your trigeminal nerve, your abducens, your 7 and 8 cranial nerve, they're all located in the pons. And then your last 4 cranial nerves are located in the medullary region, right? And of course, you need to know what the cerebrum midbrain, pons, and medulla mean. But as far as you know those structures and you know the mnemonic, it's going to be very easy for you to remember your cranial nerves and solve those questions then, right? So with that in mind, let's go ahead and help Hannah. We're going to solve this practice question. I'm going to give you a few seconds to read it, and then we'll go ahead and solve this question together. Okay, so take your time.
Vrunda, while everyone's reading the question and trying to answer, just wanted to let you know that the stream is usually like 20 seconds delay. So we may not wait for everybody to answer in the chat. You may give the tips, and I've already written down my email ID. So if they have any answers or any debatable things on this question that they want to discuss, they can send an email to me.
Sounds like a plan. Like a plan. Thank you for that. So let's go ahead and solve it, right? So Hannah is an 18-year-old singer. She's probably not Hannah Montana. If you like Hannah Montana, she probably is Hannah Montana. So Hannah is an 18-year-old singer undergoing a neuro screening due to sudden onset of some symptoms. On assessment, she demonstrates weakness of the muscles on the right half of her face, along with inability to taste with the anterior part of her tongue. Which of the following is the most likely lesion? So the first thing that you need to know over here is the function of your cranial nerves, right? So weakness of the muscles of the face, right? Weakness of the muscles of the right half of the face and inability to taste, right? Which cranial nerve are we talking about over here? I see the answers, people have started responding in chat, so that's fabulous. So that is essentially your cranial nerve 7, right? That is essentially your cranial nerve 7. So now that you've established that Hannah's cranial nerve 7 is affected, right? What do you suspect the site of the lesion to be, right? So you can either visualize the image that we discussed, or you can directly go ahead and use your mnemonics. So see me, pons, and medu, right? So C stands for cerebrum, but that's your cranial nerve 1 and 2. Me stands for cranial nerves 3 and 4. Pons is the one that houses your cranial nerves 5, 6, 7, and 8. And then medu is the structure that houses your cranial nerves 9 through 12, right? 9, 10, 11, and 12. So looking at this, your pons is the one where the cranial nerve 7 is located, right? And just with that information, it's going to be easy for you to select B as the answer, right? So as long as you know your basics, as long as you know the function of the cranial nerve, right? And as long as you know your mnemonics, it's going to be easy for you to apply that concept to answer the question, right? And I know that some of you might say that, oh, cerebrum, because with stroke also it can affect cranial nerve 7, but the presentation is going to be different. And we're not going to talk about that today. That will be covered in your live classes with Ravneet. But this is, like I mentioned, this is more of a general overview of neuro, right? And talking about some basic tips and tricks to study neuro, right? So that was the next thing that we wanted to discuss. And the last thing, this one is my favorite part as a neuro nerd. I love to apply what I have learned, right? Whether it is if you're at the airport and you just look at the way people are walking, or even in the grocery store, just watching other people's gaits, or like if somebody is doing a specific activity, like if you go to the gym and you see people working out and you're like, maybe this is not how you should be doing it. Or I think my favorite one is when older adults use a cane and they're holding it on the wrong side. And it's like this strong, always have this strong urge to correct them. And then I have to stop myself sometimes because people may not like it. But applying what you learn is like the most fun part about neuro, right? So that's what we're going to do next. Okay, so we have a picture of this very handsome person over here. Okay, and we are going to see which cranial nerves are intact in this case. Okay, so I want all of you to help me out in chat. Which cranial nerves do you think are going to be intact, right? So I can get you started. He has a very nice smile on his face, right? There's a very nice smile on his face. So that means which is the cranial nerve that essentially helps you smile? It's your cranial nerve 7. Right? So his facial nerve is intact, right? He is turning his head, right? He's kind of turning his head and neck a little bit, right? So those muscles are also intact. You have him, he's essentially looking at the camera, right? So he knows where to focus. He knows where to look. And that is telling you that which cranial nerve is intact. It's essentially vision, right? So vision is essentially your cranial nerve 2, right? So cranial nerve 2 is intact. He has moved his eyeballs, right? Maybe he was looking to the right, and then now to focus, he moved his eyeballs a little bit, right? So that is telling me his cranial nerves that help with movement of the eyeballs, right? Which are essentially your cranial nerves 3, 4, and 6. Right? It's telling me that those cranial nerves are also intact, right? So these are the little ways in which you can essentially apply these concepts, right? So that just makes it a lot more fun. It helps with retention. It helps with application in real life, as well as when you're working with patients, as well as when you're solving these questions. So just going over these concepts and applying these concepts is something that's going to be extremely, extremely helpful. And talking about application, right? Motor learning is another topic that we study when we are prepping for the APC, right? And applying these principles of motor learning, your various practice types and everything is also something that's going to help you, right? So for example, when you start studying a new topic, right? Start with your block practice. Make sure you keep revising it over and over and over and over again, right? As you start, say you're somebody who has had a 10-year break, right? Hold on, distributed. If you've had like a 10-year break or a 5-year break, or maybe you're a fresh grad who's just starting their PCE prep, right? So initially you might want to start with distributed practice, and then you want to progress towards massed practice, because your main PCE is going to be, sitting for hours and hours continuously and answering those questions. So that's when you can progress a little bit more towards mass practice, versus when you just get started with your PCE prep, you're doing a little bit more of distributed practice, right? start with your easy topics first, and then you go a little bit more towards advanced topics, right? That's another thing that you can try to implement, right? You initially start with block practice, but then randomly when you're trying to revise, that's when you go to random practice, because random practice is the one that helps you with retention. So even if you look at the PCE timetable, it's not that, oh, let's finish all neuro first, let's finish all MSK, let's finish all cardiorespy, or then let's do just ethics, right? It's very random, right? And that's the reason, because randomization helps with retention. So when you study those topics randomly, it's just going to help you retain that information a little bit better as well, right? So I know PCE Final Frontier is already doing a great job of using these principles of motor learning in their prep, but I want to make sure that all of you do the same. So with that in mind, Ravneet, I'm gonna hand it back over to you.
All right, my mind is blown. I don't know how people are feeling right now, but my mind is completely blown. Like, I've never thought somebody using my picture for teaching cranial nerves. I think I should start clicking more pictures. That's a great picture, right?
It took me a while to find it.
Right? Okay.
I wanted to find one where you were using as many cranial nerves as possible.
I know, right?
So, yeah,
But that was really innovative, Vrunda. And I've been a big fan of your teaching methods, and I think you just did another magic today. But really, thank you very much for all those amazing tips. I've been a big fan of motor learning myself. So thank you for bringing that point out, to how to start and how to move on from block, distributed to master practices. That's a great tip. And thank you for pointing out why you have to know, like why you're reading stuff, But because we don't have a lot of time, so I just want to ask two more questions to you. Let's talk about the procrastination first, like how to stick to the plan, because I strongly believe that if without consistency, you're not going to get anywhere, right? True. So you have to be committed to something if you want to achieve that. We talk about passing the exam in the first attempt, but how much we're doing really makes sense. A lot of people talk about hard work versus smart work, and the tips that you give are really like sound smart, and I've used those tips myself while I was studying, so I know how effective they can be. But procrastination is something that we all are, victims of, like in our regular times. So a lot of people have families, they have like kids, they have jobs, they have other responsibilities. So how to make a plan within about like 2-3 minutes? What do you think people should do to stick to the plan?
That's a great question. I think one thing that works really well is making a list. That's something that I started doing. I feel like even I have days where I tend to procrastinate. I try my best not to as much as possible. But there are days when, you feel bored and, you don't want to do it. So one is going to be, if you're procrastinating, that probably means that you're not enjoying what you're doing. So sometimes ask yourself, why are you doing it? Is it really that important that you should do it? Or if it's not important? If it's not important, maybe consider let it go. But if it is important, that means you have to do it, right? So sometimes just pausing, right? Just taking taking an intentional pause, just taking an intentional break, and then coming back to that topic is going to be helpful. Secondly, making a list is something that helps me stay on track, right? So I always have this notepad right next to me, and I keep writing down the things that I have to do. I also have a reminder app on my phone, and I love the feeling of like crossing things on the list. That itself acts like motivation. And then you know that if you're procrastinating and if you're not doing what you're supposed to do, the list just keeps increasing. And that itself reminds you that, okay, I know I have to do this. Let me just go ahead and do it anyway. So I feel like those are the two things that work really well for me. I just ask myself, why am I doing this? Like, what value is this adding to like my life or my career or personal life, right? And if it's really not helping me that much, it's tough to let it go, but you try your best to let it go. And then secondly, just make a list. I don't know how many of you like canceling stuff, but sometimes even if something is not on my list and I've finished it already, I'll make sure I add it and then I cancel it, because that is a very rewarding feeling. So yes, so that's what I'm going to say about procrastination and just getting things done.
That's true. That reminds me of a book. I'm assuming you must have read that book, written by William McRaven. It's about the little things that you do that can change your life. The title of the book is Make Your Bed. So I don't know if you've read that book or not. So when you said that, crossing those things is the kind of motivation, because that gives you a validation that you have achieved something. Because most of the times what happens is we are freaking out. We are not able to stick to the plan. We're not able to complete the timetable topics, right? But crossing those little things can really make a big difference. So I completely agree with that, Vrunda. Thank you. I think I'm going to skip the next question, because I was going to ask you like how to study big topics like stroke, Parkinson's, MS, big topics. But you already covered about the motor learning concept. Like you start with basics and then you slowly move on. And then you start working on the generalization, randomization, and stuff like that, right? So I think you made your point. But I think I'm just going to encourage a lot of people, because you said while you were sitting on an airport, you were observing people and just looking at their walks and how they're reacting, being weird neuro nerd at different places. So I think what we should do is we should ask our listeners to start sharing some of their stories, because I think a lot of people are in the same boat. Like a lot of therapists stare at people because they find a funny gait or they find a trick movement, right? So go ahead and share some funny moments, how you would react. And if you have any experience, somebody came and point out, why are you staring at me? Or if you have done it like mysteriously, right? So please share your funny moments with us, because your share can really help somebody to understand that everyone is like you and me, right? So it's just like a group of therapy right now. I can relate so many things when you talk about the procrastination. I can relate a lot of things while I'm struggling to understand something new, because we're trying something new and we have to learn about the stuff, right? But yeah, I think Vrunda, I think we covered a lot of things. Our main focus was to understand like how to study, because everyone who's listening is already a physiotherapist. So I don't think that anybody is lacking information. It's more about how to work smart and how to achieve the goals. So I think that's a great session on tips of how to dominate the neuro. And thank you for being an amazing person, amazing neurologist or amazing therapist. And thank you for inspiring.
I appreciate that. And I just want to end with one thing, which is I heard about the growth mindset concept, right? If you're prepping for any exam or if you're prepping for anything, right? It could be a project, it could be an exam, it could be something else that you have to finish, right? So when you say, for example, for PC, right? If you're studying and you're like, oh my God, I don't know any of this. Like I haven't finished studying this. Just add the word yet to it. So it says, I haven't finished studying this yet. Okay. Because that makes that adds a little bit of hope, that adds a little bit of positivity that yes, I haven't studied this yet, but I am going to study this, right? So don't underestimate the power of yet and just believe in yourself.
Mind blown again. But great tip. I mean, I'm definitely going to use that yet. I think that's a powerful word for sure. I can completely realize that, because that's just a reminder, man. It's such a simple word, and I can sense the power. It's a reminder. I haven't done it yet. That means you're just making a map, right? It's like a virtual checklist in your head, right? That's a great tip. But I'm just gonna, Vrunda, let's just hang out for a couple more minutes.
Sure.
If we'll see if anybody has any question, and then we'll stop the recording and everything. But I just want to thank you, Vrunda, for coming here. And I know that you are a busy person, but I really admire your compassion and I really respect your time and your valuable tips. So you know how much respect I have for you. And I think you just leveled up the level of respect that I have for you.
Thank you so much for your kind words, Ravneet. Thank you for saying that. Thank you for having me here on your podcast as the first guest, and also giving me the opportunity to interact with our amazing audience. And yeah, likewise, everything that you mentioned, I think same amount of respect I have for you as well. And you've been an amazing mentor to me as well as to so many people that I know. So it's a small world, and it's just amazing how we're able to collaborate on so many different things.
Exactly. So. Perfect. So we're just gonna hang out here for anything people have, and I'm just gonna play some music for everyone, just to keep the mood a little joyful. A little bit of the announcements for next week. We may not do a live podcast like this. We may not have any guests, but because we are heading towards the May PCE, so what we're going to do next week is we have a live session on Sunday. It's called Jeopardy. And I will still go live on our YouTube channel, and I will still do something. We'll solve some questions while we are solving questions in our live session. I'll go live for a little bit on the YouTube as well. So just hang in there. We are not going to stop our live sessions. The podcast is really helpful to a lot of people to gain a different perspective and to understand why we're doing what we're doing. But I appreciate everyone for listening to us. We're just trying to help you here. We are trying to build a positive community. We're trying to build people with shoulders who you can lean on, and we're trying to build the advocacy in Canada. So hang tight and stay tuned for the next episode. We'll see you next week. Thank you very much for joining in. Thank you, Vrunda.
Thank you all.
All right. All right, so I will stop the live stream in a minute, and then we'll let Vrunda enjoy her Sunday. Thank you everyone for joining in. We'll see you guys.